And welcome to X-ray Review. This video is about the radiographic appearance of gallstones. So let's look at a few key features of gallstones. First, they're very common. Gallstones occur in approximately 10% of the general population with a female predominance of 2 to 1. Second, you can have gallstones, get an X-ray taken, and not see anything. Not all gallstones show up on an X-ray, but they do show up on ultrasound. So ultrasonography is the gold standard for assessing for gallstones. And then there's the 5F rule. And this is who gets gallstones. This is the classic presentation. Someone who's fair-skinned, white or Caucasian, fat or morbidly obese, or high BMI index. Don't have to be morbidly obese, but obese. Female, again, 2 to 1 predominance. Fertile or multiparous, meaning having more than one child. And then over the age of 40, or a familial history, a family history of some type of disease that gives you a predisposition to gallstones. A couple radiographic features of gallstones. First, they're going to be in the right upper quadrant or maybe the right middle abdomen, and they're going to be abdominal concretions. Second, they're often referred to as a bag of diamonds appearance, and this is in reference to the clustering of these gallstones. Ironically, a real diamond doesn't show up on an X-ray. And then lastly is the Mercedes-Benz sign. And the Mercedes-Benz sign is in reference to the middle portion of a gallstone, how it has like a tri-radiant lucency inside of it. And for the life of me, I've never seen this, but it is something to know. And don't forget, cholelithiasis is synonymous for gallstones. Alright, so let's take a look at a frontal lumbar film. Normally, you do not see the gallbladder unless there's something wrong with it. It's going to be in the right upper abdomen, right middle abdomen, tucked underneath the liver. When there's gallstones inside, they're going to usually settle on the inferior aspect of that gallbladder, and if there's complications, the gallbladder can swell, cholecystitis, blockages, all kinds of things can go wrong. And when these do occur, or if there's abdominal symptoms or complications, there'll be a cholecystectomy, which is where the gallbladder is cut out and removed, and then what will be left is the visualization of 1, maybe 2 or 3 vascular clips. And when you see vascular clips in this right upper quadrant, that's typically indicative of a previous cholecystectomy. Alright, and now let's look at some cases. This is a 62-year-old female who presents with abdominal pain, and you'll note in the right middle abdomen multiple gallstones. Most gallstones are going to be clustered together if multiple, and they're usually going to be peripherally dense. So the center will be more lucent and the outer portions will be more dense. A gallstone may appear homogeneously dense, however usually that's if they're smaller and multiple. If it's very dense, be careful it's not a renal lithiasis or a kidney stone. Usually when you zoom in on a gallstone, they'll be peripherally dense with a lucent center. There are so many varying size gallstones in this patient's gallbladder, it's difficult to single out an individual one. Here are some lumbar radiographs of a 39-year-old female who presents with low back pain. And you'll notice she has numerous small dense gallstones. These calcifications can sometimes appear large and oddly shaped. And this is a 52-year-old female who also presented with abdominal pain and low back pain. And note the peripheral calcification. This is a 40-year-old female who presented with debilitating low back pain, and you'll notice some pretty large gallstones. And this patient ended up with a cholecystectomy. Gallstones can be made up of different things like cholesterol and bilirubin, and can have different percentages, which gives it a different specific gravity, meaning some gallstones can float and some will sink. Notice the amount of separation between the superior and inferior gallstones. And gallstones can be found in the gallbladder. They can also get stuck in the bile ducts. So ultimately, ultrasound or CT would be needed for a full evaluation. This is a 57-year-old female who presented with acute abdominal pain, has 2 very large gallstones, and also has cholecystitis, which is a common complication of gallstones, which is inflammation of the gallbladder. And zoomed in, we can see these pretty nicely. And here's a 48-year-old female with a relatively classic presentation of gallstones, however a little lower in the abdomen. There is little else that this grouped appearance of abdominal concretions can be, other than gallstones. This is a 32-year-old female with numerous gallstones. Given her age, there's a high probability that this gallbladder is going to be removed. Here's a great example of the smaller clustered appearance in the gallbladder in a 63-year-old female. This patient was symptomatic and had a cholecystectomy. Alright, so that was a good amount of examples of gallstones there. Let's try a few questions. What is the gold standard for assessing gallstones? And the correct answer is ultrasonography. Where is the gallbladder most commonly located? And it is most commonly seen in the right upper quadrant or maybe the right middle abdomen. And what is the best term for the visualized abdominal calcification? And that would be cholelithiasis. Alright, I hope you enjoyed all of those examples of gallstones. If you did, please like and subscribe. If you have any questions, please put them below. Thanks again.